Well, good morning, everybody. I normally do Pajama Medical in the evenings, but my life is in horrible flux right now, and I am in all kinds of survival mode trying to get through until I get some money in again. And this is why I'm looking for employment, because nobody can live on Social Security alone. It is not really that possible unless you don't want a life. If you just want to sit there and rot, you could do it, but otherwise you can't do it. So anyway, I can't do it, and I'm waiting for this to come in, and I'm in a bad situation right now trying to survive. So I apologize that I've been a little off of my usual stuff, but hopefully we'll get back to it. We're going to talk today about vital signs. And so this is something very core to nursing, very core to medicine, and so we're going to talk about it. And I don't know, people in medicine, this is old hat, and what they know, it's not going to be anything new to them. But people not in medicine, lay people, might find it interesting. And particularly if you have to go for a medical appointment or in the emergency room, this will give you more information on what is being assessed. So I think that's good for people to have. All right, well, there are five core vital signs. And it is temperature, heart rate, pulse, respiration, heart rate and pulse, same thing. Respiration, blood pressure, and something called SpO2, also called pulse ox or oxygen saturation. And it is measured with a pulse oximeter, which is a little thing they clip on your finger. And so that sometimes also measures your pulse. Why do we measure vital signs? Well, it's a base level of your overall health. So basically we are determining kind of where you stand at the time you come into the emergency room or you come into a doctor's office, maybe from your last visit. So it's for monitoring change, a basic assessment of conditions, and sometimes it is used to see if you're healthy enough for a procedure or healthy enough for surgery, or in recovery from a condition, surgery, procedure, etc. So it's very important. It just gives this basic snapshot of where your health is. And by the way, before I go further, I have a disclaimer. I am not a healthcare professional exactly. My bachelor's degree is in general psychology. I do have postgraduate hours toward clinical psychology and also in education. I was an educator for many years. I'm not certified in Minnesota. I might be able to change that at some point, but I am certified in Illinois, and I have been certified in the past in Colorado, Wyoming, and Kansas. So I was a classroom educator for a very long time. And so what I'm trying to say here is this is not medical advice, but it's just information that I gleaned and I'm passing along to you. And also, I just finished an online course through the University of Pittsburgh on clinical terminology for international students and American students. And this was a lot about nursing, and we very heavily studied vital signs. So those are my qualifications. Basically, I'm a layperson, but I do have some advanced qualifications, I think. So anyway, don't do this at home. Well, I guess you might if you want to take your pulse or your temperature or whatever. Do it at home, but don't use this for medical assessment, please. Okay, so there are the five core, let's get back to that, the five core vital signs of temperature, heart rate, respiration, blood pressure, and oxygen saturation. Sometimes there is a sixth and a seventh. So the sixth is your pain level. So if you've ever been to the doctor or to the emergency room, after an injury, and they say on a scale of 1 to 10, what is your pain level? That's what they're assessing. And also level of consciousness. So patient is alert and oriented. So they are assessing, are you responding correctly? Are you talking nonsense, or are you speaking clearly, etc.? And that also gives them a lot of information. All right, we'll talk about body temperature. Body temperature can be taken in a number of ways. Oral, the temperature thing in your mouth. Rectal, which is up the rectum. Axillary, which is under your arm, and that's usually with the mercury-based thermometer. And by the way, if you take it under the arm, it can be about 0.3 to 0.4 lower than usual. Or you can take it in the ear. They have the instrument that takes it in the ear, and they also have one that goes across the forehead to assess skin temperature. So your normal temperature runs from about 97.8 Fahrenheit, which is 36.5, if I got that correct, Celsius, to 99 Fahrenheit, which is 37.2 Celsius. And it can fluctuate a lot according to gender, activity, food, fluid consumption, time of day, and in women during the menstrual cycle, their temperature is different, I think elevated. So an abnormal temperature can be due to fever, hypothermia, or hyperthermia. So hypothermia is extreme exposure to cold, where your body is starting to basically shut down. Hyperthermia is like heat stroke or heat exhaustion and that type of thing. And hypothermia is generally defined as going below 95 Fahrenheit. Don't think there's a whole lot more to say about temperature. Fever, of course, can indicate inflammation. It can indicate infection, certain diseases, and the like. Your pulse rate is a measure of your heart rate. And so it is taken at certain pulse points. And so some of those pulse points are the base of the neck, the wrist, and did I miss one? Let's see. Those are the two usual places that it is taken. And your pulse generally runs 60 to 100 BPM. I guess you can say that you could take the pulse at the heart too, but generally you would do that with a stethoscope, I think. So in a healthy adult, pulse rate is between 60 to 100 BPM. But if you start to edge up, like 98 BPM would be on the high side. Tachycardia is something that is a fast heart rate. So that would be basically above 100 beats per minute, above that. That would be due to stress. It could be due to fever. It could be due to dehydration, anemia, arrhythmia, and that type of thing. And then we have bradycardia, which is just the opposite. So tachycardia is very fast heart rate. Bradycardia is very slow heart rate. And that can be actually, bradycardia can be actually, in athletes, that can be normal. And I was once an athlete. Believe it or not, I did martial arts and I ran like 10 miles every day. This is when I was much younger. Believe me, I don't look like this anymore. But I at one time was in very tip-top shape. And what happens when you train and you are an athlete is that when you your body begins to kick into running or something like that, your heart rate will go down. And so well-trained athletes might have a slower heart rate. And that's normal for them, and they don't experience problems. It's because the heart is well conditioned. Also, bradycardia can occur in sleep, different heart conditions, some medications can cause it. So then we go to respiration. Typical adult respiration is about 12 to 20 breaths per minute, and that is at rest. There is tachypnea, which is very rapid breathing. That can be from fever, anxiety, metabolic acidosis, or something I can't read. The one thing I have in common with doctors is my writing. Sometimes I can't read it. Oh, or the rapid breathing can be from substances, that type of thing. There is bradypnea, which is slow breathing, and that can be from head injury, sedation, medications, severe hypoxia, and other such causes. Then we come to blood pressure, and of course this is a very important element of the vital signs. And so a regular blood pressure is considered about 120 over 80. 120 over 70 is even better, so somewhere in that range. It's elevated well, first of all, there is a systolic number, which is the top number, and there's a diastolic number, which is the bottom number. The systolic number is the number basically when the heart contracts, and the diastolic number is when the heart is at rest and the ventricles are filling with blood. So what happens then when your pacemaker sends the heart is contracted, and then it sends this message to the ventricles basically to rest and begin to refill again before it contracts again and starts the cycle all over. So the systolic is the contraction, the diastolic is at rest when the ventricles are filling with blood for the next contraction. So elevated blood pressure would be from 120 to 129 systolic, top number, to 80 or below diastolic, bottom number. Then you have prehypertension, which runs from systolic of 130 to 139, and diastolic of 80 to 89. Then you have hypertension, which is 140 or above on the systolic, or 90 or above on the diastolic. And that is where you start to run into trouble, really, because you're running a risk of heart attack, stroke, heart failure, kidney problems, etc. And if it's in that area, it needs to come down. So you need to do things to bring it down. There is also hypotension. Hypotension means low blood pressure. And so hypotension occurs at 90 systolic or lower, over 60 diastolic or lower. And that can be from dehydration, blood loss, shock, and some medications. And then there is the SpO2, or it is also called pulse ox, from short for pulse oximetry, and also called oxygen saturation. Now, this is generally measured, but at sea level, which we're flatlanders here in Minnesota and the Midwest, so this isn't quite as important as it would be in the Rocky Mountains where I've lived. So in the Rocky Mountains where I have lived, I'm sorry, I always have this rogue hair. where I've lived in the Rocky Mountains, is very important because it can indicate, first of all, when you first go up in elevation, there will be a big change in your SpO2. And also it can indicate some very severe conditions if you're very high up. And so it is very important to monitor. They were always very careful at a medical appointment, in the ER, you name it. Anything medical, your SpO2 would definitely be included in the Rocky Mountains. So now it is being routinely added to the vital signs, but it's still a little touch and go on flatland, but definitely at altitude it's going to be very important. And by the way, I think my first Pajama medical video was on pulse oximetry, so I will include that link. Then there can be 6th and 7th vital signs that I think I mentioned that. Pain level and the level of consciousness. I believe I already mentioned those. So did I miss anything? Hopefully not. Let me go over my list here. Is there anything else I want to pass on to you? I'm not going to go into how to take these things. There are various types of blood pressure cuffs. There are various types of thermometers. The pulse ox is generally a clip-on your finger, generally. What else? Respirations, you watch a person breathe, but there are machines that can assess it. And so I'm not going to go too much into how to do that. Let's see if I have anything else here that I wanted to pass on. I think that's basically it. I had several sites that I gathered information from, and I'm just trying to see if it was a little bit difficult to get it all together after you take notes and notes. Okay. So I'm going to put some links in about vital signs, but when I was taking my course, and because it was a nursing course, we really got into things like, you know, so if you have a slightly elevated blood pressure and then you have a slightly elevated respirations, you know, and things like this, what could that indicate? And, you know, there's a number of things, but there's a lot they can tell from vital signs, and it is very core to medicine. Something else I want to pass along is there are different types of blood pressure cuffs, and you can get self-monitoring blood pressure cuffs. I have one. I should have probably brought it out for show and tell, but that's because I had a problem with hypertension, which is getting better. And so I did get a cuff so I could monitor it myself. And then if I have it here, the Heart Association has instructions for monitoring, which I think I wrote down. One moment, if I can find them. Of course not. I'm sorry, I had so much different information. I'll try to put a link for that if I can find it, because it's here somewhere. But one thing to note, I've had a lot of people say, you know, are the wrist blood pressure cuffs, and I think there's fingertip ones, are those accurate? They are less accurate. So just so you know, they are not as accurate as a regular blood pressure cuff, and they are more expensive as well. So I'm not to say they don't work, but they are just less accurate, just so you know. I think that's about all I have for this. I hope it was interesting, and I'm sorry that I'm a little off on my things that I'm doing, because I am trying to get resettled in a new place, and this is a process that just takes time. And I hope it was interesting to you, and I do have several different links to put in. Have a good day.